It's the Thursday Morning House Call with Dr. Lane Aiena. Brought to you by Huntsville Memorial Hospital.
Hey, good morning. Big Len with you in studio with me, Dr. Lane Aiena. Good morning, Dr. Lane.
Good morning. How you doing this morning?
Well, I tell you what, doing great. Why? Because the Walker County Fair and Rodeo Parade is tonight. The rodeo opens tomorrow night. Man, it's going to be a weekend and actually 9 days of fun.
Oh, that's awesome. I'm so excited. The kids always get so excited about the rodeo and to get to sit that up close and personal with the horses and the bulls. Man, the kids they really get a kick out of it.
I love it. All right, so let's move on. Okay. We are talking off air about it's important that you get your vaccines.
Yes. So we've done a lot of episodes where vaccines get referenced. They get a good shout out. This time of year, not as many people are sick, so we do a lot of yearly physicals. So I got to thinking, I've been talking until I'm blue in the face with people about their vaccines, and we've done shows about childhood vaccines. It was a long time ago. I mean, we may be due for a refresher here soon. I don't remember us doing a show dedicated just to adult vaccines. Now, for today, when I say adult, I mean after 50, and I will give you the age range as we go, including one that's kind of gone back and forth a little bit. Well, back, just not forth yet. We're going to talk about that today. So after you turn 50, a new slew of vaccines become available to you in addition to your colonoscopies. Congratulations. So the first one that comes up at 50 is the shingles vaccine, Shingrix. Now, this is a big one. Back in the 20-teens and before that, it was called Zostavax. So some people will say, I already had my shingles vaccine. Well, we got to dig back. Which one was it? And sometimes it's kind of tough because now we're a decade ago, right? If you had Zostavax, the old one, Shingrix is a better shot. Now, I haven't thought about this since residency. I think Zostavax was like 60% effective, which ain't bad. But Shingrix is 90% effective. 1 in 3 adults will get shingles. This will reduce those odds by 90%. And if you do get it, it is a significantly milder case. This is a vaccine I really push because shingles is miserable. When you do what I do, you see a lot of shingles and you see a lot of miserable people, and you see some of these shingles cases turn into chronic neuropathic pain that might have been able to be prevented with a couple shots. Now, let me dig into that. It's 2 shots. You get 1 shot now, 1 shot in 2 to 6 months. If you miss the 6-month window, you still just go get the second shot when you can. The first shot is generally pretty well tolerated. I always tell my patients, get the second shot on a Friday when you don't have a busy Saturday. That second shot can make you feel a little sick the next day, a little blah, a little feverish, but I tell you what, it's better than shingles. So it is a great trade-off if you are one of the people that feel a little under the weather from that shot. Well worth it. Definitely. If you're over 50, talk to your doc, go get your shingles vaccine. Number 2 is the pneumonia vaccine. Now, this is a big one. This is a very important one. Pneumonia, I don't have to tell you. Well, maybe I do, because people kind of think of pneumonia as a cough, and then they get pneumonia and like, doc, I feel terrible. I'm like, yeah, dude, pneumonia is awful. It really knocks it out of you. It's a big reason for hospitalizations. There have been other versions of the pneumonia vaccine in the past. There was the pneumonia 13, the pneumonia 23. If you had either of those, and it has been more than 5 years, you need to get your pneumonia vaccine. It's now the pneumonia 20, or if you've never had one and you're over 65, you need your pneumonia vaccine. Now, it gets a little confusing. There was some talk from the CDC about moving it down to 50, which I'm not opposed to. Insurance hasn't really caught up yet, and that's an expensive shot. They will cover it, however, if they say that you qualify. So if you are over 65, I'll say the guidelines again. If you are over 65 and you have not had your pneumonia vaccine, or it has been more than 5 years and you had one of the other ones, talk to your doctor, go get your pneumonia vaccine. Let me muddy the waters a little more. If you smoke, if you have an immunodeficiency disease, if you have heart disease, lung disease, chronic diabetes, you may qualify, and it may be very important that you get your pneumonia vaccine earlier. If this is confusing, that's okay. You and your insurance pay a guy to keep up with all this. It's named your doctor. Go see him. Go see her. They will tell you if you qualify for the pneumonia vaccine. That's a big one, very important. One that we will do an entire show over is the flu vaccine. Go get it September, October, whenever it comes out. And then, of course, the COVID one. This one is not coming out on as set of a schedule yet, but they seem to put out a new updated booster every fall. I always go get it when I get my flu shot. That's how I remember. And you want to get it, the COVID one, you want to get right when it comes out because COVID mutates so fast. So you want to make sure you've got the most up-to-date version, because once COVID mutates a few times, you're not getting near as much mileage out of it. Still helps, but not as much as if you were to get it hot off the presses, as they say. So folks, just because you're not a baby doesn't mean you don't need your vaccines. After 50, you start right back at it. It is very important, and your yearly physical is a great time to talk to your doctor about, hey doc, what am I due for? What can you give me? Give me one on each arm. Let's get me safe and protected.
Fantastic. What a great edition today. All right, that is this week's edition of the Thursday Morning House Call, brought to you by Huntsville Memorial Hospital.
Let's keep Huntsville healthy.